Thank you very much, Chair, and may I thank the Minister for being here this morning to answer a couple of questions in relation to the vaccination and the vaccination strategy. I think it's very important here today, Cathaoirleach, to outline to the Minister the worries that people have around what's going on at the minute with the AstraZeneca vaccination and the appalling way in which they have treated Member States of the European Union and the body as a whole has been incredibly unfortunate, considering the significant and major investment that has been received by that company in public funds across the EU. We need to absolutely ensure that they hold up to their commitments to the European Union. In a certain sense, I think Ireland is being held hostage by that situation regarding vaccinating our population, and there is a high degree of expectation on this government and on you to deliver in this particular area. But unfortunately, we don't produce vaccinations at the end of the day. It is a multilateral approach that is required in this particular issue, and progress in terms of vaccination can only be achieved by Member States working together and working united with one another as well. I think that's very, very important to say. Minister, I suppose another thing I would like to put across to you in terms of the separate groups in society that have all been inquiring about when they will receive their vaccination. Obviously, it is imperative that those that are most vulnerable would receive the vaccinations as soon as they possibly can. But if it is at all possible, I think an area the government should put enormous focus on when the appropriate time arises is on trying to return our teachers and our students to secondary education full-time, and perhaps looking at that sector and giving it increasing focus when it comes to the vaccination strategy and where they lie on our chart at present. And from my point of view, I think that is one of the only ways in which we can return people to normality in education as well. And look, there may be many bumps along the road that we haven't encountered yet, and I'm sure that we will meet and rise to those challenges when they do arise. And I have every confidence in both you and your junior ministers in your department, who are working exceptionally hard to deal with these challenges. But I do think that when looking specifically at the issue of getting our children back in our schools, getting our students sitting their state examinations properly again, that we have to try and get them vaccinated as soon as possible to minimise the risk on their growth and on their development, because at the end of the day, this has been an absolutely horrific incident, I think, overall in terms of the pandemic on the development of our children, on their lives, and it's made a massive dent in growth and development for anybody growing up in Ireland today, unfortunately. And it's been incredibly challenging for all age groups, but particularly for children in our society. Minister, I would maybe perhaps ask that you may give some information as to your understanding of what is actually happening with AstraZeneca at present. I think I'm under the understanding as of this morning, although it constantly evolves, that they are meeting with the European Commission tomorrow, but perhaps you in your capacity as Minister may be able to provide the House with some information on that, so I'll give you the rest of my time, if that's okay.
Okay, you have a minute, Minister.
And I'd like to thank the Deputy for his contribution and questions. And can I just say that I agree wholeheartedly with the Deputy. We need to get the information out to people. There's a real hunger, particularly now with the over 70s, who are asking, well, how is it going to happen? When am I going to be contacted? That information will be out shortly, and a lot of it is going to come from the GPs to their patients, but there will be information out shortly on that. And I guess the most important thing to say, Deputy, is people will know ahead of time when and how they are to be vaccinated. With regards to AstraZeneca, it's an ongoing, robust exchange between the Commission and the pharmaceutical company at the moment. There hasn't been closure on it. There was a meeting late last night on it, and there is still no agreed quantity of supply to the Commission, and therefore to us we take 1.11% based on our population
okay, thanks,
with the
Minister.
company at this point.
Deputy Neil.